Hello, everyone. Today we are with Anne-Lise Lavaur, Head of Programs at Solidarities International. After studying political science and children's rights, Anne-Lise became involved in international organizations and became Program Coordinator and Advocacy Officer. In 2014, she joined Solidarities International in the Program's Technical and Quality Department, where she took over as coordinator 8 months later. In 2018, the department evolved into the direction of operations assistance to programs. It is a pleasure to welcome her on this episode of WHF Talks.Live. Welcome, Anne-Lise. I'm very pleased to have you here with us today.
Thank you. Very happy and glad to be here too.
So a great conversation is waiting ahead of us, and I would like to start with my first question to you. Solidarities International's work in Lebanon led to the creation of innovative wash systems throughout the country, connecting refugee settlements to local water sources and reducing dependency on truck deliveries. Can you tell about Solidarities International's experience with this and what lessons can be learned from innovation potential in demanding scenarios?
Yes, of course. So maybe 2 words about the context in Lebanon. We are in a protest crisis, so since more than 10 years now. We have 1.5 million of Syrian refugees in Lebanon, and this is 21% of them are in ITS, what we name ITS, so informal settlement. Sorry for saying IS maybe in the next few minutes. This is an increasing trend now with the actual financial crisis, and SI is supporting right now 1,500 IS. So this is big. There is many sites of different size and different geophysical status. We'll come back on this later because this is one of the most challenging parts. These people have no access to basic needs, especially wash services, without external support. So the main challenges we are facing, we as humanitarian actors, SI, but also all the others, are the restrictions. So governmental restrictions first. The government of Lebanon is refusing the installation of permanent structure in informal settlements. So IS are supposed to be temporary, and we cannot really, we can't install permanent structures. Landowner restrictions. We are facing also landowner restrictions. They are refusing infrastructure on private land or negotiation, and municipalities restriction. So the 3 levels of restriction, because then we don't have any access to the area. What we do is 2 kind of things. So we are working on the water supply side and on the sanitation side. I insist on the sanitation side too, because we always speak about water and safe water. And I think sanitation is one of the big gaps we are facing in the humanitarian sector. And SI is very emphasizing on innovation for sanitation in emergency, because we are all aware now of environmental issues and we need to work on it. So the main objective of SI wash innovations in Lebanon is to reduce dependency on costly and unsustainable humanitarian aid for wash services, naming, of course, water trucking and dislodging. What we all know that there are very costly solutions. On the water supply part, we are simply connecting to local alternative sources when we have local sources and when the landowner accepts. So then the idea is to, of course, reduce the volume of water delivered, and then the cost, saying, okay, we are reducing the water trucking, so reducing the cost of water trucking. We have an objective of reducing 1.1 million USD per year, so saving all the cost of water trucking. We are facing challenges of contamination in these local sources. So this is a problem we are trying to resolve with water treatment systems on site. Ultrafiltration system, reverse osmosis, so to provide more safe water on site and to reduce the cost of the water trucking. On the sanitation aspect, same thing. The idea is to have treatment on site. So through septic tanks, treatment filters, to reducing cost of dislodging. Then we have less need of dislodging, saying maybe once or twice a year only, And then we are reducing the pollution, positive environmental impact, and potential reduction of inter-community tensions. That last but not least, because IS are often located near water bodies, and as waste is not managed properly, then they are perceived as polluters by local Lebanese populations and media, etc., etc. So more globally, I would say 3 main lessons learned about innovation in complex settings from our side. I think the one is very interesting because I used to say that complex settings and barriers are conducive to innovation because the classical solutions don't work under particular conditions and constraints. Then field operators and actors, as my project managers, WHF project managers, then need to be creative and adapt the response to cover the needs. Then I think the Lebanon example is a good one to see that the alignment of humanitarian actor and donor strategy led to powerful adaptation and project quality improvement. And the third one, what I wanted to emphasize here is the internal organizational challenges. I would recommend to not underestimate the adaptation of human resources, technical skills, of course, because we are not using exactly the same project management capacities, etc., monitoring capacities, training. And also, I have to say, I must admit that the switch to a cost efficiency perspective is something not that easy for us.
Yeah, that's great. You mentioned about some obstacles, and can innovations in humanitarian settings overcome the obstacles posed by the government? I know this is a bit more broad question, but over to you.
Yes, I think, again, the Lebanon example is a good one. I would say when the government is present and restrictive, we can overcome governmental restrictions, for example, the refusal of permanent structures as in Lebanon, but we can't overcome the government itself. So we're saying, okay, here in Lebanon, all solutions are discussed with the Ministry of Energy and Water and are supposed to be removable. So then when we leave and when Syrian refugees will leave, then all the site can be fully decommissioned and cleaned. So this is what we can say, okay, we discussed with the government, we can really overcome the restriction, but we can't overcome the government when they are here and present and restrictive.
Okay, that's great. Thank you for the explanation. A report by ELRA discusses 5 key challenges to innovations in the humanitarian sector. The first being that innovations are not geared to scale often. Can you tell us what this means and how this barrier can be overcome?
Yes, I will try for this, but I fully agree this is a problem. This is a big challenge. I would say, first of all, we are facing a dissemination challenges. Because of the dissemination, this is not a phase well recognized as we need to put big effort on the dissemination. And this is closely linked with the scaling capacity, I would say, of an innovation. Then scaling and innovation, I would say, first of all, on the technical side, I think there is big specificities of each context of intervention. My WHF people in the field are always saying, Anne-Lise, there is no one fit all solution, and we need to adapt to the context. So maybe we find a way to have a regional scale to use, and that's interesting because then the adaptation in similar contexts can be improved, and really we can have a leverage with the regional scale, I think, to facilitate the scale up, not saying, okay, this solution will work globally, but maybe regionally with similar contexts and adaptations, of course, for each context. This is on the technical side. I think there is a big cultural barrier to develop strong research and monitoring protocol. And this is always the problem, I would say, to have a rigorous protocol and monitoring for the pilot, saying, okay, at the end of the pilot, I can say this is scalable. And for this, to overcome this, what I have tried to develop within NSI is to develop partnership with research and academic actors, saying, okay, let's say we are operational, we know our limits, but let's have a good research and academic partnership so we can have the right protocol to say, okay, here we have a good solution and we can try to scale up and to disseminate. Then the temporality of humanitarian projects. Everyone know we are working in short-term projects, and that's not compatible with the need of longer-term monitoring and active learning, I would say. Of course, we are trying in innovative processes to constantly improve the solution. And so I would say, yeah, the solution maybe is the need to have flexible multi-year and multi-country funding. But I think we will come later on the funding part. The last thing I would say is the high technicity of most of the innovation solutions. Innovation is mostly linked with high-tech, very complex solutions, etc. And I think there is a need of non-complex and maybe very simple solution, low-tech. I'm prone to say that I like low-tech solutions to have more sustainable and solutions you can hand over locally and easily. Yes, and the last one is the scale-up phase is often linked with the economic sustainability of the solution. And I think we need to work on the cost recovery in the humanitarian sector. And I'm not sure we can really overcome this difficulty, but the most common culture is to have free license, to share solutions, to have good practices, exchanges, solutions, collective learning, and this is difficult to sell a solution, I would say, to others and say, okay, I have a good solution, please pay for it. And yes, we are more kind to mutualize solution rather than to develop lucrative solutions, I would say. And to be honest, I'm not sure I want to change this.
Thank you for your comments. As you mentioned, a gap in funding for scaling is also identified as an obstacle. Can this realistically be overcome to make innovations effective in enough time to help fulfill the SDGs by 2030? Can the costs be cut down in any way?
I'm not optimistic regarding the fulfilling of the SDGs by 2030, I have to say. We are working with the most vulnerable people affected by crisis and in remote or in high constrained success area. And I realistically can't say that the SDG 6, for example, will be achieved by 2030. But to reduce cost, maybe there is some solutions. I was speaking about low cost innovation. This is one of the ways to think innovation and to have less cost related to innovation. Low-cost innovation and solutions are mostly more sustainable and easy to reproduce from one context to another. And the partnership and mutualization is one of the way I see to develop and to really increase the impact of solution and to adapt easily to context and to another organization. Really, I think we are piloting right now different innovation with several operational partners, so we can share the risks, we can reduce cost, and I think this is one of the way we need to investigate more in depth.
I have another interesting question for you. In an article for Care Insights, Newby argues that a heavy focus on innovation in humanitarian aid and international development has gotten in the way of using already known solutions to solve ongoing injustices, and thus is a distraction from the lack of political will of leaders to make meaningful differences. Does this create a compatibility gap between the goals of the humanitarian sector and the realities of innovating and its sometimes unintended consequences?
I think the main risk maybe for us is to focus the organization on head office or global innovation. For example, very high technological one, as we said, and maybe this the gap is bringing more communication than impact. And I say my recommendation is to develop field-oriented innovation, really to keep the focus on field-oriented innovation and not the global one who maybe have a big change in the humanitarian sector and in communication, but maybe less on impact directly on beneficiaries or population. And yes, again, to keep in mind that we are looking for sustainable and easy to develop solutions. I think another way to overcome this risk, I was thinking about it when I saw your questions, and I was thinking that the ways to promote participation and co-design also. This is another way to think about it and to say, okay, how can I overcome this risk? Is to really reinvent the participatory methodologies and to facilitate the integration of the population within the innovation process. And for example, we are speaking about Lebanon, and again, maybe this is a good example for illustrating this point. We are developing now a WhatsApp bot in Lebanon. What is it? It's an innovative project with the support of the GSMA, the Worldwide Mobile Communication Association. And this is the main objective is to develop a communication channel, so very direct access to beneficiaries within beneficiaries NSI, so Solidarities Internationals. Again, the context is a no-camp policy, so in Lebanon, so we have people all split it all around the country, and the WhatsApp bot will be then 24/7 access to SI, free to use, versus high charges on a classical hotline, I would say. So we are looking for cost efficiency, accessing more people, saving time for a response, for example, and we're trying to cover all type of needs with this. So access to info, access to services, service request follow-up and ownership. And of course, we are able to handle mass communication. And for example, maybe a good one would be the first pilot we had with the WhatsApp bot is the specific use for a monitoring exercise following a vaccine campaign in IS and the COVID-19. And we had like a distribution of a COVID kit by UNICEF. And then we send through the WhatsApp bot message and survey to, I don't know, maybe more than 13,000 numbers. And so we had a very high rate of response and answers on this WhatsApp bot and this communication channel. So we can easily say that's a good way of thinking. So more accountability, we are more accountable. We are trying to really push for more transparency and accountability towards beneficiaries.
That's great. You mentioned about a field-oriented innovation, and you are a very operational humanitarian aid organization. So how can we know when an innovation is working as intended? Can any kind of measurement of success be used to determine an innovation's results on the field?
It's a big question, you know that.
I know.
I think what I used to say to my teams, to my program teams, is innovation cycle. The whole innovation cycle is closely linked with the learning process. So we need to have a continuous learning process, an active process, saying, okay, accept that innovation is an iterative process, and we need to really be better on the active learning. I'll say always, we need to develop active learning and to readapt the solutions and to rethink our answer and solutions we are implementing. I think this is very important, not just to look at activities and results, but also monitor the process of innovation itself. So this is not only a good project monitoring, I would say, this is also to monitor all the process, the methodology, and the scalability of the innovation. So basically, very pragmatically, I think we need to answer these kind of questions. For example, did we learn all along the project or no? Lessons learned have been collected or no? Disseminated within the humanitarian actors. We were speaking about dissemination, and I think this is a key success factor of innovation. I was thinking also on the gap. Maybe we can address the gap between the expected results and the effective results. So saying, okay, what I was expected at the very first beginning of the project and what do I have at the end of the project? And really to think, I think maybe more changes and impact rather than activities and results. And I think this is very helpful for us humanitarian actors to think a bit more longer term and really like impact indicators. Now that we have big debates about impact measurement framework, we are all working on global and impact indicators in the humanitarian sector. So innovation may be the way to think a bit more and longer term and really on the impact of the intervention. Of course, we need also to have any tangible evidence. I think innovation, but also the methodology has worked. And I think so these two things are very important to keep in mind. This is not only the results, but also the methodology and all the process. And then, of course, because we spoke about it, the replication, I think, has been the innovation replicated by other actors and in other contexts, etc. This is a good success indicator, I think. And then, of course, the satisfaction rate of the population.
It's great. At WHF 2021, as we call, is the year of hope. We are trying to get out of a global pandemic with the vaccine rollout and the testing improvements. We just need to be hopeful, I think. That's why we called 2021 as the year of hope. And innovation is a very important pillar to create hope as well. What would be your message to our audience today as your final remarks about being hopeful from 2021 and innovations?
I say, don't have just one, but maybe four. The first one is no. So innovation is not just for big or rich organization. I think we can illustrate this with Solidarity, and this is a big hope message. So you can be small and have good innovation processes. I think we need to be risk averse. It is worse. So we know that we are in a very volatile and complex settings, etc. But we need to be risk averse, donors also. And then this is really worse to develop an internal innovation-friendly culture, I would say, in the humanitarian sector. I think innovation is a great multi-actor tool also. So we have a way and a bridge between the private sector, public sector, and we have here a way to communicate better and to have a common interest and to develop great solutions. And at the end, maybe my final word would be then to please keep the focus of innovation to improve project quality and not to disconnect innovation processes to the willingness of having at the end of the day maximizing the change in the life of the population. This is a great tool.
Thank you so much, Anne-Lise. It was a great pleasure to have you on WHF Talks Live, and I look forward to having further discussions.
Thank you very much for you all.